Hello, and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at celiac.com. And now, let's move on to the latest Celiac.com news. A new approach to celiac disease treatment, engineered immune cells. For people with celiac disease, the only current treatment is a strict, lifelong gluten-free diet, which can be expensive, restrictive, and difficult to maintain. But what if there was another way to manage the condition? A recent study explores an experimental therapy using specially modified immune cells to help control the body's harmful reaction to gluten. While still in early stages, this research could pave the way for future treatments that reduce, or even eliminate, the need for dietary restrictions. Celiac disease is an autoimmune disorder where the immune system mistakenly attacks the small intestine when gluten is consumed. Most people with celiac disease carry a specific genetic marker called HLA DQ2.5, which makes their immune cells overreact to certain gluten proteins. Normally, regulatory T cells called Tregs help keep the immune system in check by preventing excessive inflammation. But in celiac disease, these peacekeeper cells fail to control the aggressive effector T cells called TEFs that attack gluten. This study investigated whether engineered Tregs could be trained to stop gluten-triggered attacks. Researchers used advanced gene editing techniques to modify immune cells in two ways. First, they created engineered effector T cells called ETEFs to mimic the harmful gluten-reactive cells in celiac patients, helping scientists study their behavior. Second, they developed engineered regulatory T cells, eTregs, modified to recognize gluten but act as suppressors, calming down the overactive immune response. The study revealed several promising results. The engineered cells migrated directly to the gut and lymph nodes, where celiac immune reactions occur when gluten was introduced. Even more impressive, eTregs designed to recognize one gluten protein could also suppress reactions to other gluten proteins, meaning fewer modified cells might be needed for broad protection. Additionally, the eTregs only activated when encountering gluten, so they wouldn't unnecessarily weaken the immune system. While a gluten-free diet works, it's not a perfect solution. Accidental gluten exposure is common, and many people struggle with social, financial, and nutritional challenges. This study offers hope for an alternative. If e-treg therapy works in humans, it could allow some gluten tolerance, minimizing risks from accidental exposure. Unlike short-term medications, engineered cells might provide long-term immune control. And since similar therapies are already being tested for other autoimmune diseases, development for celiac treatments could move faster. While promising, this research is still in early stages. Key questions remain. Will these modified cells cause unintended side effects? How long will the suppressive effects last? So far, tests have only been done in mice and lab settings. Human studies are needed next. This study represents an exciting step toward a new kind of therapy for celiac disease, one that tackles the root cause, the misdirected immune response, rather than just avoiding gluten. While it may be years before such treatments are available, the research opens doors to possibilities beyond the gluten-free diet. For now, patients should continue following medical advice, but they can also look forward to a future where managing celiac disease might become much easier. This experimental therapy uses modified immune cells to suppress gluten reactions. It's not a cure yet, more research is needed, but early results are promising. If successful, this could reduce reliance on strict gluten avoidance. This breakthrough highlights how science is moving closer to innovative solutions for celiac disease, offering hope beyond dietary restrictions. To get the latest celiac disease news and information, be sure to subscribe to celiac.com news. Thank you for tuning in, and see you next time.